I have to say this is an unbelievable honor. Thank you, Brooke, for having me come out here. I was texting friends back home. I was bragging about how I'm going out to Harvard, this place with rich tradition, and I'm just in awe that I'm here presenting at the place where Facebook was invented. This is an amazing opportunity for me, and I also understand Jeremy Lin played here, so it's a lot of great stuff. A couple past presidents, I guess, but it's been wonderful. So again, thank you. I'm going to use this slide to highlight what our problem is, okay? Is it too loud? I'm going to use this slide. Look at this poor little kid right here. He's not even 2 years old yet. He's got a little racket. Can anyone read his shirt? It said, "I'm told I like tennis." There's a problem here, okay? This kid is doomed. This is my son, okay? And he's the son of a dad who absolutely loves tennis. I gotta be honest with you, I took him out yesterday and he was actually picking up the ball and serving like this. I'm not joking. I was so excited, and I couldn't control myself anymore. So, it's okay. It is okay to be excited about sports as a parent, as a coach. And the only issue is don't drink the Kool-Aid. We have to recognize when isolated examples of Andre Agassi or Tiger Woods or Jenny next door or Jimmy who got a college scholarship happen, and they only did one sport or they started at 3 years old. Those happen because of pure coincidence, and that's not how we should really be evaluating the data. So data actually supports a different approach. We publish an evidence-based review of basically all the sports to decide when the appropriate time to start early intensive training was, and only one sport, gymnastics, actually, because it's early entry, specialized and did intensive training before the age of 12 for success at the elite level. And every other sport was beyond the age of 12. So I think we have to change that mindset. We have clear evidence from a global perspective about when that time is appropriate. The other part of it is your genetic predisposition. David Epstein wrote a nice book called The Sports Gene, which basically says you have a certain defined hardware or amount of genetic predisposition towards your sports success. You can train up to the maximum part of it, but you can't train beyond it. Poor little Kishan, I know, will never be an NBA basketball player. He'll never play in the NFL, and to my great disappointment, he will not be a professional tennis player. I'm pretty sure his genetic predisposition is going to be winning the state math competition with the rest of his teammates, okay, getting good grades, making the tennis team, not going to homecoming, and about 20 years later, going to about 75 terrible dates, finally meeting his wife in his mid-30s, and then producing a child. So this is what he is destined towards, and I have to accept that. It's going to be hard, okay? But I will get over it. So I think a reasonable goal is going back to college and getting into college. And not everyone can become a professional athlete, but getting a college scholarship or being able to play college sports is a very reasonable goal, and I admire parents who want that out of their kids. What does it take? Well, three independent studies, at three major powerhouse institutions, UCLA, University of Texas at Austin, and those Loyola Ramblers from Chicago who last made the tournament in 1985. We did a study over there, and all supported the same conclusions, that the athletes themselves in college, when you look back at their training leading to college, did not specialize any differently than non-athletes. They didn't specialize early, and they actually played multiple sports even into high school. The UCLA study actually supports one other thing, is that the biggest predictor wasn't the age of specialization, which is not different compared to student athletes, but actually having a first-degree relative who played college or professional sports. So again, back to the genetic predisposition. So if you want to get your kid into college, it is not necessary to do this. What does that leave us? Well, we create this perceived success. That's what I call this perceived success of training early, training intensely, and then trying to accomplish these potential goals, and that leaves some kids sitting on the bench. So they're not participating, they're just sitting on the bench and not actually playing, and at some point, they become disinterested. And that disinterested kid ends up choosing other things. And this is actually, the biggest problem actually is middle adolescence, and particularly in females. And girls tend to drop out of sports at that age, and that's really the vulnerable age. And where does that leave us? Did anyone ever play Pac-Man? You guys are old enough to play Pac-Man, right? Do you ever realize when you're playing that game that you're following those little dots and trying to eat them up, and these ghosts are chasing you, and you have a certain amount of time and everything? When you're playing it, do you ever realize that this game really sucks? It's a terrible game. Look at the games that we have now. They're unbelievable. I mean, I see these kids playing these video games. They're so realistic and, the graphics and everything, animation, and we're losing to that. And why would we? Well, these games are competitive. They're fun. They're not exclusionary. You can actually play with other people. You can be in the comfort and safety of your own home. Your parents don't have to worry. And they're not that expensive. They're basically everything that sports should be now, which sports for youth sports is not. And that's where we're missing out. And we're losing to the new Pac-Man. So where do we get involved with this? Well, I, like Dr. Hainline, have a tennis background. And I actually really just stumbled in this whole thing. I actually can't believe that I'm here in a way. And now I speak in a lot of places about this. And I really just started with several studies looking at tennis players. And we looked at about 500 of our Midwest junior competitive tennis players. And we were just evaluating training patterns and so on and so forth. So I threw in a couple additional questions about sports specialization. And we found out that 70% of those tennis players specialize in tennis. What was the age that they specialized? Anyone want to guess? What age did they specialize? Yeah, 10 years old. On average, 10 years old. And by the time they get a little bit older than that, almost 95% of them were specialized. We did find an association between specialization and their reporting of an injury that was significant. So we reported it. It just happened to come out at the same time. Andre Agassi wrote this nice little book called Open, and there was a lot of publicity around it and a lot of publicity around our work. And we were on different TV shows and this and that. And then things got extended beyond just tennis, and people wanted to ask, well, does that mean specialization is bad? That must mean specialization is bad for all sports. And I said, I don't have the data. I can't tell you that. I think it's right, but I can't. So then I had to catch up and start doing studies to support what we thought would be the bad idea of just specializing in a single sport. So we collaborated with one of our local Lurie Children's Hospital and us at Loyola, and we followed 1,200 young athletes who present to our clinics for either an injury and compared them to athletes who are just coming in for a sports physical. And we've been following them over, the last 5 years. Imagine trying to follow 1,200 young kids every 6 months, try to get them to do surveys and follow them for injuries. We found some pretty strong associations. We'll actually be publishing this shortly. I have to go home and do my revisions tonight. That there is an independent risk for specializing in a single sport despite how much you train and despite your age. So those are strong predictors for injury as well, too. So it's pretty clear for us, and in fact, it's dose dependent. The more specialized you are, the more likely you are, in fact, to have not just an injury, not just an overuse injury, but serious overuse injuries, and I think that's the crux of it. So those are injuries that keep you out for 1 month or greater, and those are stress fractures in the back and osteochondral lesions and things that are really bad. So we need to pay attention to this data. Not paying attention to it is a gamble. We know that this data itself is pretty clear. There's data on baseball pitching. If you pitch more than 8 months a year, or particularly if you pitch with shoulder-arm fatigue or pain, your risk of shoulder and elbow surgery may be up to 35 times higher. You don't need any more data to tell you that it's a bad idea. So we also found a couple of what we think are pretty good training rules. And those training rules are simple. We need to age adjust. So we said, if you do more hours per week of your sport than your age, do you still have the same risk for serious overuse injury? And that is true. So if you were 16 years old, you should be under 16 hours a week. If you were 10 years old, you should be under 10 hours a week. The second thing is, I was looking at the data and I noticed we were looking at organized sports hours per week and then free play. What's free play? Oh yeah, that was when we were growing up. You just play for fun. Remember that? You just play sports for fun. So that ratio as a group in our study is about 2 to 1, 2 to 1 organized sport. That's reversed from when we grew up. We used to just play for fun and have a few practices a week. Well, if you exceeded that ratio of 2 to 1, you were also significantly more likely to have overuse injuries as well as serious overuse injuries. And so in certain sports like tennis, it was about 4 or 5 to 1. So we're trying to change that mentality and trying to get people to do that free play concept again. So, well, what does it cost? What's the cost of participating at this level? Well, pay to play. Well, we know there's lots of costs of being involved in these high-level sports programs and travel and equipment and everything. So we actually did a little socioeconomic analysis of our 1,200 athletes. And what was interesting was that we had about 20% of them who are on public aid. And public aid in our state is, if you make $17,000 as an individual, and I think it's about $30,000 as a family, qualifies you for public aid. So these are very low-income kids, they actually had significantly fewer serious overuse injuries or rate of serious overuse injuries, and also had significantly lower rates of specialization than their counterparts who were actually on private insurance. And in fact, they participated in sports, and or I should say, they participated in physical activity for more hours per week than their counterparts. So they're actually doing more stuff, and they're playing for fun more. Their organized sports are about the same, and still they're protected from the serious injuries that result as far as overuse training. We need to learn from these folks who don't have anything. I like hearing things that Holly brings up and Doug Costa brings up, things that don't cost money but still protect our youth, and these are things that don't cost money. So don't tell my wife about this last slide. Women have it right. I know. But they do. Have we had interventions by organizations and assessed them? No, except for one. The Women's Professional Tennis Tour, about 25 years ago, recognized that there was too many young professional tennis players going out on the tour, having short careers, getting burnt out and leaving. So we have to do something about this. So they created an age eligibility rule and player development programs early on, and they worked in, actually, the number of tournaments you're allowed at 15, 16, 17, 18. And they basically got to the point, they did a 10-year follow-up, and now I'll be helping with their 20-year follow-up this year, actually. And they found that essentially nobody retired before the age of 21, which was a pretty common thing back then, and that career longevity significantly increased at pretty much every age they entered the tour. We need more sports organizations looking at their own problem and saying, look, let's go ahead and move forward and try to make some changes. So let kids be kids, right? This is a motto. We need a message. Let kids be kids. So the most likely person to introduce a child to a sport is your parent. But the most likely person to introduce them to intensive training is your coach. But this is a discussion I have with a lot of parents. It is your job as a parent, it's your job to monitor your own child. And ultimately, it's your job to decide when is enough and when's too much. So if we say maybe diversification is a good idea, and you come back and say, well, my 10-year-old loves to play tennis 20 hours a week, and how do I tell him no? Well, if your child said, I also love to sit, watch TV, and tickle my belly button for 4 hours a day, you would find a way to say no and say you probably should go to school now and maybe do something else more productive with your life. So you need to set some parameters for them and help them decide what's best for them, okay? We want to encourage free play like we talked about before, playing for fun, which of course there's safety issues in today's world. But we're doing a new study looking at this issue of parent play, which I'll try to introduce as a term. And we're looking at a study of parent-child dyad interactions and whether there's a positive impact on their health status. And seeing also if parents exercise with their kids, is there a health benefit? So we're looking forward to that. We're actually just got IRB approved, and we enrolled a bunch of tennis kids, and we're seeing how that plays out. But I believe that we should encourage more of those opportunities, which is still free play and for fun. And nothing is more satisfying than smoking your dad on the soccer field or the tennis court or your mom and still going out to dinner that night and having fun. So don't make exceptions. Everyone says, that's great, these are the rules, but that doesn't apply to me. I had a mom of an 8-year-old gymnast whose daughter does 27 hours a week of gymnastics. It kind of exceeds our general rules, and I know it's more hours per week than your age, but I understand gymnastics actually does kind of fall out of it, and I know, but at some point you have to listen, you have to pay attention to data at some point. So you have to have a middle ground. So don't make an exception every time it's your kid. Organizations and coaches, we need to change a couple of the ways that we look at how things are structured, because I come from the tennis world, and while I have a lot of well-meaning parents, the system is point-based and it's volume-based. So no matter what, if you come off, it's 12 months of points. So if you come off from an injury and then you're out for 3 months, you have 9 months to make up the 3 months that you're off too. So you just start doubling up your tournaments and try to catch up your points. And that's all dictated by a point system. And when we host 10s nationals and 12s nationals in different tournaments and they travel around, then I think that creates problems. So we do need help. I know this is a grassroots effort, but it gets stunted sometimes by organizations that haven't looked completely at their own sport, saying what is the best for the health and safety of the child and lifelong participation. Now, hockey did make changes. They saw participation drop. They adopted American developmental model, and they actually encouraged kids to do multiple sports. They didn't want people to do only hockey, and then actually their numbers have gone up. And so if other organizations can follow that lead, that would be great. Follow these age-appropriate guidelines, and also we have specific training rules, and there's other very specific rules, involving ACL injury prevention programs and heat issues, and try to make sure that our organizations are actually endorsing this at every level. The last thing is we as medical professionals have certain goals, and we need to give specific advice. I think the last thing parents want to do is bring their kid in and have the doctor say, well, he's just playing too much, so maybe just don't play too much. And it's not very helpful, and be aware of what it takes to be successful in a sport. And sometimes it does take 16 hours a week of training, or if you're in dance or gymnastics, it may take 16, 20 hours a week, or even tennis if you're playing at the elite national level, and recognize that. And if someone is at high risk, and what I negotiate sometimes is say, let's try some increased monitoring. So if you're at high risk, let's see you a little bit more often. If you have high blood pressure and diabetes, and you have a history of heart attack, you see them every 3 months, right? So the same thing, if you have a high-risk kid, maybe you need to see them a little bit more and find some way to monitor. We need to look into sport-specific research. One of the complaints of our research is it's cross-sectional, looking at about 25 different sports. So each sports organization will say, well, that doesn't apply to us. That doesn't apply to us. So we do need sport-specific research. But I'll also say that if you're trying to cross a railroad tracks and a train is coming at you, you don't need to do an evidence-based study to tell you get off the railroad tracks. Someone's going to hit you, okay? So you probably should, go ahead and listen to when we have medical organizations giving sound advice. I think it's worthwhile, and that's where those medical advisory boards can be very helpful. And things like what MomsTEAM is doing is actually helping, I hope, help some of these folks make some better decisions. And the last thing is messaging. Who remembers don't do drugs, this is your brain on drugs? And that will always be imprinted, those little eggs, that will always be imprinted in my mind. And we have to figure out what our message is. Each of us give a message. I like the message of let kids be kids, because that's really what it's about. It's this adult-driven organization for sports that has probably led to some of the overuse problems that I see and that we've researched. And I think with some slow implementation and changes, we can give a different change. And I'm really hopeful for a world where we actually have kids who play sports for fun, have lifelong participation, and are still active and healthy as an adult. And maybe, just maybe, with your help, Kishan can play sports, get good grades, and go to homecoming. So thank you so much for your help, and thank you all for your time, and Brooke and MomsTEAM, okay?